Here we see the before and after picture of a sleeve gastrectomy. So this is normal anatomy, esophagus, stomach, small intestine, and this is the result after a sleeve gastrectomy operation. This is a laparoscopic surgery. It's done in full anesthesia, and what the sleeve gastrectomy does is that you resect and remove a large portion of your stomach, and what is left is then this small portion of the inner curb of the stomach, which is the sleeve stomach. And that is very small, it's very restricted, and that means you will have to change your eating habits, eat smaller meals, have a different meal pattern than what you had before. The other mechanism that contributes to weight loss is the fact that here, in the part of the stomach that is removed, you have a lot of your starvation hormone cells, your ghrelin cells. And if you remove them, you will have less hunger, and therefore it will be much easier to keep your weight off over time. This is a newer operation than the gastric bypass. It has not been around in large volumes for as long time, meaning we do not have the same long-term results yet as we do with the gastric bypass. It's a very effective procedure, but everything else like the same. A gastric bypass will always be slightly more effective, but when it comes to weight loss than the sleeve. A benefit with choosing a sleeve can be that you have a good absorption of nutrients and vitamins from the gut. It could also be a benefit if you have previous intestinal problems, because the surgery does not involve the small intestine the way a bypass does. A side effect of the sleeve is that it increases your risk of reflux, with the risk of heartburn and so on. And of course, the other potential risk with a sleeve gastrectomy is the risk of slight weight regain over time. But it's still a very effective procedure.